you and I had experience dealing with health crises, and public health crises. And in each instance, what you and I understood, and why I have so much confidence that you're going to be able to deal with COVID in the way that other countries with our kinds of resources are dealing with it right now, which is smartly. I have confidence that you're going to actually listen to the experts.
Yeah.
And you're going to pay attention to the science. And you're not going to quit on trying to actually bend down the curve of disease and transmission rates.
When we left office, you had set up a pandemic office within the White House. We had people from the CDC, 44 people in China. We knew pandemic diseases. This wasn't going to be the only one that ever occurred.
And the goal was to create an early warning system around the world by creating international cooperation so that when you saw it coming, you had time to prepare.
Right.
I don't like having thousands of people around when you don't need them.
David Leonhardt, can you go through, you wrote about what got us here. If you can, list some of the key areas that really put us in this pretty desperate situation.
Yeah, we focused on 5, Mika. And so one is the lack of effective travel restrictions, which really is ironic. I mean, my friend Ross Douthat, an opinion columnist at the time, says, we have a xenophobic, germophobic president. You would think he could have put in place effective travel restrictions. And he talked about travel restrictions from China, but they had huge holes in them, and he didn't put in any travel restrictions meaningful from other parts of the world. So travel restrictions, the testing failure, which people have talked about so much, you've talked about, the mixed messages on masks. I think it's important to note that the whole world for a while had mixed messages on masks because the public health experts were basically wrong about this. But in other countries, as the evidence emerged on masks, you saw leaders saying, wear masks. You saw Emmanuel Macron in France, wearing a mask that perfectly matched his blue suit in very French fashion. But in this country, President Trump and other political leaders, some other political leaders, have cast doubt on masks. Then you had the confusion about whether, in fact, public health and the economy are in conflict, which they're not. And finally, and this is sort of spans everything, you had incredibly mixed messages from our political leaders. As one of the people we interviewed said, look at how Angela Merkel talks about this in Germany. Look at how other leaders talk about this around the world. It's consistent. They say take it seriously. They say act. They put their government behind it. And we haven't had that. And look, this is a really hard problem. There isn't a country in the world that hasn't struggled with it. We see little flares or even more than little flares in Europe, in Australia right now. When you look at the numbers, the scale of those new outbreaks in these other countries is just of a different order of magnitude. There is no rich country that looks like the United States right now in terms of the scale of the virus, the scale of death, and the amount of chaos that it's sowing in terms of our normal daily functioning.